for startups seeking to secure international capital while maintaining operational independence? No? Okay. I see that Hassan Josem Al-Nawais is not with us. I now go to Dr. Njide Ndili, a friend of the house. Please let's join our hands and give her a round of applause. Dr. Ndili, the only woman on the panel today. Thank you for being here, and for Informal Markets for remembering to put a woman there. Dr. Ndili, she's the president of Healthcare Federation of Nigeria, and she's country director of Farm Access, Nigeria. Now let's talk a bit more closer home, private sector, especially in Nigeria, as a case study, delivering a significant portion of healthcare services. Yet we see that integration between health tech startups and established providers remain limited. How do you see healthcare federations and private sector networks bridging the gap between innovative digital health solutions and traditional service delivery systems to improve efficiency, quality, and affordability of care? Over to you, ma'am.
Thank you very much. It's a pleasure to be here, and apologies I wasn't here yesterday. I think that's a very important question. I think the health sector right now is seeing a revolution, or an awakening rather, because it is one of the sectors, in fact, the least sector adopting digital to improve its services. Last week, or was it 2 weeks ago, I was at the Africa Digital Health Summit in Nairobi, and it was amazing, all the innovations that are coming out of the healthcare system, albeit fragmented. So it's an important question. And the reason we're seeing, pilots in the health sector not scaling is because you have a divide between the innovators and the startups who are, these are young, a lot of them are young people, especially in Nigeria, who are thinking, how can I, develop a system that, and it goes through quick iterations. And unfortunately, oftentimes they are not implementers, or they don't own hospitals or systems within the healthcare system. So there's a huge divide. Again, I think that there is a platform to bring them together. The old traditional system, often, I dare to say, owned by older men,
Dinosaurs, you mean?
older doctors who are analog and still don't understand the impact of digital. In fact, the fear is that, digital AI is going to take over my role. No, I think that technology is an enabler. So the most important thing is to be able to bring them together. And that's where platforms like the Healthcare Federation comes in. We are a not-for-profit, federation that is almost like a lobby group, and it's an advocacy group advocating for private sector to come with innovation, transparency, to be able to help the governments improve efficiency in the health sector. So for us is, how do we create a platform that enables innovators to partner, innovators to test their solutions, and then be able to scale it. So I think our work is just getting started, because we have now been embedded, at least in the case of Nigeria, within, we've been pushing for what I call public-private integration, not collaboration, not partnership, but integration, where we are not seen as an outsider, but rather we sit at the table with government. We bring technology, we bring ideas, and we craft it together, including the policies. I don't see my minister here, but hopefully he'll be around. But the government of Nigeria has been very deliberate about including private sector. So we're now part of the Whx Compact. Just last week, we also had a very interesting roundtable with the DG of the National Health Insurance Agency. And what he charged private sector is, look, the likes of the banking sector, insurance sector, general insurance, electricity, you name it. The private sector has come in and been able to develop innovation that breaks open the market. In Nigeria, we have a huge missing middle. almost, we talk about a country of 250 million people, and less than 20 million are covered by any kind of health insurance. There's a huge informal sector, and we still haven't been able to crack how to bring that sector into the health insurance platform. So can private sector develop innovations, maybe through telco? Can you pay small, as they say, with your data? Are there tech solutions that are out there, albeit fragmented, that can help government to fold in this informal sector? So I think the recognition now, especially with the reducing overseas development assistance, that private sector can actually be the bridge between, government, between the innovators being able to showcase what they have, and be able to embed it within systems. So I think that's a role. It's a very critical role. We're still unpacking it, but I think that there's a lot to be done, and we're positioning and poising ourselves to be able to bridge that gap as the federation.
Thank you so much for sharing. We've heard her, the Healthcare Federation. I know Nigeria, and I know that there's also one in Ghana, and in other countries across the continent, with their efforts to make that integration happen. So the first step is to agree that indeed the gap does exist, and without deliberate effort to integrate and to recognize the disparity between these two groups, we won't be moving ahead. So we really thank you for sharing those very remarkable comments. I'll now go to His Excellency Augusto Gomes, the former Minister for Health of Guinea-Bissau. Thank you so much for honoring us on this panel. And the question to you is to share with us from your experience while you were minister and what you see now. We know that you still, of course, are very relevant in the conversations ongoing as far as the digital health revolution is concerned. What do you think primarily should be prioritized from a government perspective, talking about the regulatory framework, and what obtains? What do you think we should put first as far as the revolution is concerned? Over to you, Honorable Minister.
Bonjour et merci Madame Dr Merlis Atoki. Bonjour à tous les participants. Bonjour aux collègues panélistes. Je suis Augusto Gomez. Comme Madame la modérateur dit, je suis ancien ministre de la Santé publique de la Guinée-Bissau. C'est un plaisir pour moi d'être là devant vous, parmi mes collègues, participer à cet important forum de partenariat pour la santé de chez nous. Ce que je peux dire pour démarrer, c'est de remercier de façon infinie l'invitation qui m'a été adressée pour être participant à cet important événement. Je vous remercie, je remercie Madame l'ambassadeur Nancy qui a tout fait pour que nous arrivions à cet forum. Pour
Please, let's join our hands to give Nancy an applause for doing that. She's done incredibly well. Please go on, Honorable.
On devrait arriver dans le premier jour, mais dû au défi des vols, on a juste arrivé hier soir. Mais c'est déjà c'est une bonne chance d'être là pour participer à cette panel. Grâce à Dieu, nous sommes là. Et dire que mon expérience en tant que ministre de la Santé publique de la Guinée-Bissau, même si c'est pour une période très courte, dit que quand il s'agit de la santé, l'Afrique doit être une Afrique pour une seule santé. Nous tous faisons de la santé la maison commune de tous les Africains, de tous les pays. Nous sommes l'Union de l'Afrique, nous sommes des frères de différentes communautés, CEDEAO et autres. Et quand c'est comme ça, la santé ne connaît pas les frontières physiques que nous avons. Nous avons les mêmes populations et nous devons partager les défis et partager les solutions pour soulever les défis. Donc, l'expérience de la Guinée-Bissau comme un petit pays entre le Sénégal et la Guinée, et ayant la Gambie à côté, c'est un pays qui partage l'expérience en matière de combat, en matière de lutter contre les maladies. Mais il nous faut s'accrocher aux grands pays, oui. Il nous faut partager l'expérience avec des pays qui sont un peu plus avancés. Il nous faut l'innovation. Il nous faut travailler en partenariat avec des institutions, que ce soit africaines ou occidentales, pour améliorer l'assistance sanitaire aux populations africaines, aux populations de nos pays. Donc, Madame, la Guinée-Bissau a un système national de santé qui est un système en construction, avec des difficultés, avec des manques de conditions, des manques de moyens, des manques de financement, des manques de technologie. Mais c'est un pays qui souhaite soulever toutes ces difficultés-là. C'est pour ça que nous sommes actifs en participant dans des événements tels que ceux-là. Donc, la numérique, l'innovation, l'IA, c'est la voie, c'est le destin. Et la Guinée-Bissau partage cette vision-là. Donc, on peut avancer ensemble vers ça. On peut avancer ensemble vers l'innovation. Donc, la Guinée-Bissau n'a pas assez d'expérience à partager dans ce sens, mais on peut partager la volonté d'améliorer notre situation de soins de santé en Guinée-Bissau. Merci, madame.
Thank you so much, former Honorable Minister of Health Guinea-Bissau, for sharing those very passionate words. We do hear him talk about the necessity for African countries to work together, to learn lessons from each other, and together drive this digital innovation and revolution in the way that we all deserve. We thank you once again for sharing those insights with us. I'm now going to go to Nabil Daha, of course, the Senior Division Manager, Nihon Kaden Middle East. Thank you for joining us and for being here with us. We'd like to hear from you in your experience and all of the remarkable work you've done in Nihon Kaden. What do you consider as the challenges in these our times of digital revolution as far as the African continent is concerned? And what solutions have you preferred from your organizational point of view to these challenges? Over to you, sir.
Thank you very much, ma'am. I'm representing Neo Coding, Middle East in this conference. Thank you all for attending to listen to us, for all audiences. Thank you very much for attending, for giving me a chance to speak about how we as Neo Coding actually introduced the DHS, the Digital Health Solution, in our region, also including Africa. Okay, so Neocoding started as a medical devices, and then we moved into the integration part. Then we moved into the data collection, And then we move into the applications such as telehealth or the AI that I hear from the ministries today. So we are really covering the whole aspect of DHS, okay, and we have the experience for this. We've done it in North Africa, already in Morocco, okay, as they speak two languages, the English and French, and the Arabic, of course. And then we have also regions like in the middle, from Kenya, east and west. And then we have the South Africa, which in South Africa, we have also introduced our DHS. So the challenges that we face, actually, there's two aspects, the technical and the clinical. The technical part where we need all the hospitals to be ready for the networking. What I mean by networking, the hospital should invest in having a very strong network for their own equipment available in the hospital, provide a data center where we can integrate or save the data into their data center, okay, and then that aspect, once we have it ready, all the medical devices should interact with your infrastructure that already invested in our hospital, from the Wi-Fi to the network of the wired, okay, and to the data center. This data that can be collected in the data center, and then we can start applying the AI, the telehealth, into your collection of that data. The important thing is all the medical devices should be a neutral devices, which means that you need to be able to connect, to have that as standard in your hospitals, and to connect a medical device to your system, to be able to do this. Okay, and that's why we are ready. We are agnostic medical device company that we can interact with all the medical devices already available in the region. Once we have that ready, once our device is already connected in your hospital, your data center, we can now access it from anywhere. And this is the key for us from the clinical perspective. We have the issues that we face is staffing. Intensive is not available in our countries. Rural areas we cannot access. So how we will be able to access these rural areas? By providing the telehealth. That telehealth, the doctor can see it from the capital city and then looking at all the region around your areas and diagnose the patient through an audio visual or looking at the vital sign from the telehealth or the tele ICU as we say it, or and then we can talk to the patient, see the patient from that perspective and collect that data. Along with this, maybe sometimes you don't have enough intensivists, or we need to guide these intensivists. So we provide the AI. As I mentioned, I hear AI. We have a tool to predict the risk indexes, such as in the ICU now, most of your patients are sepsis patients, correct? So all these sepsis patients, they are into the reactive mode. All the intensivists that going into the reactive mode. If anything happens at that moment, that patient will be in critical already. But our system with the AI, after collecting all this data from all your devices, from the lab as well to integrate, from the X-ray to integrate, and from the infusion pumps available, not only like patient monitor, any devices that connected to that patient, we collect this data. That case present a sepsis, he survived, we take that case as an example, and we start analyzing with our AI. We have a good background of this AI concept. We already doing this 3 years back in the US. We have a University of Virginia with more than 250,000 patients available on our AI to train the models for all these risk indexes that are available for the ICU as an example, like sepsis, hemorrhage, discharge patient. We need to understand all these concepts. This is, when we get to that stage, I think 5 years down the road you will see that, and then we will see the benefits. From the financial point of view, the benefit is now we have length of stay is reduced. The medication that you will give is already in advance. No need to put them on a ventilator. If you provide this AI before that, it will predict that this patient, it might go into sepsis. So the AI should not replace your intensivist. It should be a guidance or guidance to your field already. We already invested.
Absolutely,
a
Mr.
doctor.
Nabil.
Okay.
And thank you for sharing those incredible work that you've done and for sharing the challenges from a technical and from a clinical point of view.
Yes.
And please a round of applause for him.
Thank you
for
very
sharing
much.
those very examples and lessons we can learn from Middle East as an African continent. I'm now going to go to Dr. Barnett Bangi. I hope I didn't murder your name. And I thank you for joining us from Village Rich. Dr. Barnett is the Vice President of Global Programs, Village Rich. So a bit of history. We know that over 60% of Africa's population lives in rural or low connectivity areas where traditional health service delivery is somewhat challenging. What low connectivity or offline capable digital solutions do you see that have proven most effective in reaching the last mile populations, and what strategies ensure that these innovations are sustainable and scalable? Over to you, Dr. Barnett.
Thank you, Madam Moderator. That's a long question. I hope you'll give me like good time.
We will try.
First of all, thank you for inviting us. Quickly on Village Reach, why we are invited really to speak on this topic. Village Reach is 25 years old this year. Was founded by Gracia Machel in Mozambique and a Cameroonian tech entrepreneur. They were flying together on a plane to Washington, Seattle. They discussed, and eventually when the cyclone hit Mozambique, Gracia Machel called Blaze, and they started really trying to deliver vaccines to rural communities, partnering with a gas company called Vidagash, and that's how all started using, cold chain and all that. So right now, as Village Reach, really our goal, our focus is, to reduce inequity and reach underreached communities and support strengthening health systems and provide responsive primary health care that is responsive, accessible, and adaptable. And we focus really on getting products to people, strengthening human resources, primary health information systems, using innovation, digitalization, technology, and also involved in emergency preparedness and response. Now, on the issue of low connectivity, I think I need to start with a quick story, briefly. In all of you in the region know, of course, the Ebola that hit this region in 2013. It started in Guinea in December 2013. By May 2014, it was in Sierra Leone. I was based in Sierra Leone, heading one of the UN agencies, the UN country team SAT, who were awarded work, who got pillars to lead. WHO was leading treatment, UNICEF WASH, and risk communication, WFP logistics, and WHO was doing treatment, So UNFP were awarded to work on surveillance. I'm giving this story because it is 13 years ago, and there was innovation involved. There was partnership with the private sector, and we worked with telephone companies in Sierra Leone, AfriCell, Aircell, and they sold us phones at $10, and we were able to establish a system of contact tracing to trace Ebola contacts. And these phones enabled us to pay the contact tracers, and they sent us reports on small phones, tiny little phones. Now, what was the message here? Really, the message was here for digital solutions at scale, at last mile. The main issue is simplicity. These were not smartphones. And we were able to deploy 2,500 contact tracers.
Oh, wow.
We had community, what they call closer used groups, so we could communicate, we could pay them, and they did the work. And for me, that was a game changer in the response to Ebola.
Now, in terms of today, again, we think for digital solutions at last mile, scale depends on simplicity. Strong system integration, looking at financing, obviously. These systems have to be easy to deploy, they should be interoperable, and they should look at national systems that are existing. So we say in low connectivity environments, complexity is not innovation. It is actually a barrier. So if you are looking at these low connectivity areas, you have to look at simplicity. Now, what we have been doing is really work with governments, with ministries of health, look at the real health problems, the system problems, and then look at decisions that need to be made. We look at basics, the data quality, the infrastructure, the workforce capacity, and the policies. These are the factors that determine what kind of systems you deploy. When we look at the tools to choose, the technologies, again, we have to design for reality, not aspiration. What do I mean by this? Connectivity, we know, is improving at a slower pace that doesn't match the needs we have. So if we are designing for scale, we need to start with offline use. Look at offline use, look at intermittent syncing, and look at basic phones, using basic phones to start with. You have to design for constraints. This is not a compromise. This is the fastest and most reliable pathway to scaling. The examples I can give here as the OpenLMIS, which is an open source system that Village Reach has been stewarding. This was built on an offline infrastructure. The telehealth solution in Malawi is called Chipatala Chapa Phone, which means health center by phone. And then there is a system we are also supporting in Mozambique called Alvida. All these are using voice and SMS. We are now discussing adding chatbots and other systems. So really simplicity is the key for remote settings.
Right.
Simplicity is the key.
Of course.
Now,
I'm telling you to round up too.
The other one is trust. I don't know whether you still allow me to continue or...
If it's the last one,
Yeah.
Please go ahead. Trust.
I still have many more, but let me talk about trust. Trust really is the foundation. If you are engaging communities, the communities need to trust you. They need to know who is behind the service. They need to trust the channel. And they need to trust that their concerns will lead to real action. Thank you.
Absolutely. Thank you so much. There's a round of applause for him for his remarkable comments. And we've heard about simplicity. I think that is really quite important for us to think and layer all of these complex sounding solutions sometimes around, especially for the usefulness of Africa. Maybe that's a way to reconsider some of the solutions. So again, thank you for those remarkable answers and examples that you have shared with us, Dr. Barnett. I'm going to come to Dr. Babatunde Ominola last because he came late and he's also a friend. So please join me in welcoming Dr. Babatunde Ominola, who's joined us very quietly on this panel today. But before I come to you, sir, I'd like to ask the Honorable Ambassador Dine Buraima, the President, Africa International Tourism and Economic Council. Thank you so much for joining us. The Honorable Ambassador will be speaking French, and so please use your translator to hear him. I would like for him to share with us what examples in the African International Tourism and Economic Council, as far as digital revolution for Africa is concerned, would you like to share with us what should we be thinking of in the health sector to do differently or to be prepared around that you've already achieved in the Tourism and Economic Council as a sector? Over to you, sir.
Merci beaucoup, madame. Avant d'aller plus loin, je voudrais vous présenter M. Dine Buraima, qui vient de Cotonou au Bénin. notre ministre, M. Benjamin Mbati, aurait souhaité être présent. Il me charge de vous saluer tous. Vous savez que le dimanche passé, il y a eu des événements fâcheux dans notre pays, notamment la tentative d'un coup d'État, ce qui a fait que l'équipe qui devait arriver n'a pas pu arriver. Mais néanmoins, je suis là pour les représenter et je pense que je ne vais pas vous décevoir. Avant d'aller plus loin, je voudrais très sincèrement remercier les organisateurs qui ont voulu mettre en place cette belle conférence qui parle de l'intelligence artificielle, de la santé et autres. Et remercier particulièrement l'ambassadeur Nancissa, qui est également la représentante régionale de High-Tech World. Madame Nancy, je vous remercie de m'avoir invité à cette importante conférence. Venons maintenant à la question que vous m'avez posée. Il faut savoir que sans la santé, il n'y a presque rien. Vous savez, très souvent, on a l'habitude de dire que c'est souvent au docteur qu'on ne ment pas. Lorsque vous êtes malade, c'est seulement au docteur que vous ne pouvez pas mentir. On peut mentir à tout le monde, mais dès que vous êtes en face du docteur, vous êtes obligé de lui dire la vérité. Et c'est pourquoi, moi, je pense que l'intelligence artificielle, c'est une opportunité pour l'Afrique. Étant entendu qu'en matière de santé, en Afrique, il y a plus de 1,2 milliard de population qui a besoin de santé. Et particulièrement dans ce lot, on a près de 820 millions qui ont besoin de santé urgente. Et lorsqu'on a l'intelligence artificielle, tout à l'heure j'avais dit que c'est une opportunité puisque c'est une nouvelle science qui met les pays africains comme les pays européens au même niveau. Donc on peut démarrer avec eux et autant que nous sommes, on va pouvoir évoluer ensemble. L'intelligence artificielle permet de résoudre plus facilement des problèmes. Particulièrement, j'ai vécu un cas qui m'a beaucoup secoué. J'avais une parente avec moi à la maison qui avait des maux de ventre. Et lorsque la parente m'a expliqué tous les différents mots, j'ai mis dans ChatGPT et je lui ai demandé de quoi il s'agit. Et la réponse était que c'était une ligne qu'il fallait aller, c'était une appendicite, je crois, qu'il fallait aller automatiquement à l'hôpital. Effectivement, j'ai eu confiance en l'intelligence artificielle, on a été à l'hôpital, et je vous assure qu'après les analyses au niveau de l'hôpital a confirmé que c'était effectivement une appendicite, et la personne a été opérée systématiquement. Et après, le docteur nous a dit que si on n'était pas là dans les 12 heures, c'était sûr que la personne allait mourir. En fait, qu'il devait y avoir beaucoup de complications. Donc l'intelligence artificielle a aidé à sauver cette personne-là, par exemple. Donc, c'est pour dire que je sais que l'intelligence artificielle présente beaucoup de défis, parce que ça menace beaucoup de jobs. Mais en matière, dans la vie, il faut dire que quelque chose dont on ne peut pas s'opposer, il faut aller avec. On ne rame pas à compte courant, parce que, à mon avis, il est impossible de ramer contre le courant de l'intelligence artificielle qui envahit tout aujourd'hui. Donc, en tant qu'Africain, on doit profiter de cette opportunité pour pouvoir mieux faire les choses. Merci.
Thank you so much, Honorable Ambassador, for sharing those very remarkable personal experiences, especially about using artificial intelligence. And yes, the message to all of us today is to remember why we are here, to remember the times that we're in, and that artificial intelligence has come to stay. So the earlier we embrace it, the better. Thank you so much, Honorable Ambassador, for your remarkable comment. I now go to Dr. Babatunde Omilola, the banker in our midst, from AFTB. Dr. Omilola is the head of Division Human Development, AFTB. So let's talk about blended finance mechanisms. Having increasingly been used to de-risk private investment on the continent. Yet we see health startups still facing high capital costs and limited access to patient financing structures. How do you see the African Development Bank structuring your digital health investment pipeline to de-risk private capital, and what innovative financing mechanism or instruments are proving most effective for scaling health tech across multiple countries in Africa, especially? Over to you, Dr. Milola.
Thank you very much, my friend moderator. Good morning, Excellencies, Ministers for Health here in the room, colleagues and friends. Always a pleasure to be here in your midst and to have a conversation, especially how we can strengthen the healthcare system in Africa, but more importantly, in terms of financing healthcare. Let me start by saying that the fundamental issue is for us to take health as a serious business on the continent of Africa. Health should not just be seen as a social good, but it should be seen as an economic imperative that can help us unlock economic growth, that can help us to achieve substantial GDP on the continent. We have seen from research that Africa is losing $2.4 trillion annually in terms of annual GDP output because of lack of investment in health.
Wow.
And if we actually invest in the sector, we can double our economic productivity. Having said that, the African Development Bank, it's a multilateral development bank on the continent. We have a callable capital of $318 billion across all areas that we work in for development in Africa. Our main goal is to see developmental impact in Africa, whether ranging from energy to agriculture to industrialization to manufacturing to health to education to all critical sectors. And for health, we have a strategy for it, which is our first strategy for health since the creation of the bank. And that strategy is a strategy for quality health infrastructure in Africa. It's also looking into digital health, digital infrastructure. It's looking into innovations in health service delivery. And we work not only with governments, because most people think our primary aim is to just work with governments in Africa. We also work with private sector entities. We fund private sector companies across the continent that are focusing on delivering healthcare. The good news is that our board approved for us that we can spend up to $3 billion ramping up our health support on the continent by 2030. They also approved for us that we can support local manufacturing of pharmaceuticals and vaccines and medicines in Africa with an additional up to $3 billion by 2030. So in terms of financial muscle, we can say we have close to $6 billion that can be spent on the health sector and on pharmaceuticals in Africa. And all of these resources are not only for the public sector, they are also for private sector. But what I would say in terms of interventions very quickly, number one, I would like to see more public-private partnerships on the continent. I came here from Namibia, where I've seen that they have some good hospitals that are there, but then in the public sector arena, they are struggling, just as many other African countries are struggling when it comes to how equipment are functioning. And you can have the private sector playing a critical role by running and managing such equipment. It could be cancer centers in many of these public health centers. So that's one way. For us, in terms of financial instruments, I think when it comes to working with the private sector, we are looking mostly into debt financing as much as possible. We can also do equity financing, and we can also do, we can provide guarantees, to all of this to happen when it comes to private sector. We're already working on a few projects across the continent in terms of private sector, but what I would like to see more will be collaboration between the public sector and the private sector in terms of PPP arrangements. And I think this will work well for the continent. So we have the instruments to do that. In fact, we have a dedicated unit focusing on PPPs transactions across the continent, looking at how the public sector and the private sector can collaborate and work together to deliver healthcare delivery. Now, I want to say something very fundamental, that it's not just all about financing. We also provide policy, knowledge work, policy advisory services to both government and private sector entities. I have seen in my experience going throughout Africa that there are some cases where the financing will be there. A good example is South Africa. You know, I've traveled to all the 9 provinces of South Africa, and I've seen that in some of the provincial governments, they have the financing to support healthcare delivery, but yet they were facing issues such as maternal mortality. And the main reason for this is not because financing is not there, because they return their budgets back to the treasury at the end of their fiscal year in most cases. But the issues are that they don't have the right personnel to deliver such health services, and also there is no proper collaboration between the public and private sector for health service delivery, which prevents a lot of people that should be accessing healthcare to access them. And so, because of this, we need to see how to marry the 2 sectors together. And I think that's what we are preaching now at the African Development Bank. And as we look into the future, we have a new president that is trying to come up with some reforms in this area. And I think we are going to see how to unlock more financing for the health sector and for all the other critical sectors in Africa. But more importantly, I think the key message that I want to leave behind is that the bank is your bank. You should come to us, especially ministers for health. You have not been making the case very seriously. You know, you need to make more economic case to the ministers of finance, who are the governors to the bank, so that they can step up and come up with official requests to the bank, and then we can be able to support you in healthcare delivery. Thank you very much.
Brilliant. You've heard it from the bank. Thank you so much for sharing that with us and for letting us know that we have you to come to and to rely on in all of these national development efforts. You did just, it was as if you were here when the president was talking very emphatically about public-private partnerships and the need to largely consider private sector's competencies and usefulness in some of this infrastructure and equipment that are injected into healthcare and healthcare delivery on the continent. So we really thank you for those very remarkable comments. We're now coming to the end of the session, and I'd like for all of us to think about your closing thoughts in just a minute each. And I really mean a minute, please. I'd like to start with Dr. Omilola. Please, your parting thoughts in 1 minute, sir.
Well, thank you very much again. I think, I think we should have more conversations like this, more dialogue, but we need more economic case situations in different African countries, whereby we connect health to economic progress, economic development, and whereby we start taking health as a serious business that can not only just provide healthcare delivery for our citizens, but also provide sufficient income and revenues even for governments and for private sector entities as well. Thank you very much.
Absolutely. Thank you very much. And Nabil?
Yes, thank you very much. We would like to see the collaboration. We would like to see in the ministry, to see what their needs and the requirement in each country. And we will do as a consultation. We want to collaborate. We want to do a collaboration and consultation with each of the ministry now. As I see that there is a lot of demand for the DHS. And I hope that I would like to see every one of you in each country to start talk about the DHS and how we can support it. So this is our hopefully wish to see that we go back to the country and then we see you again.
Thank you very much for being here, for your closing thoughts. Ambassador Dean? Can we help with his mic, please? I'll give him another mic.
Merci beaucoup. Je disais tout à l'heure qu'à la suite de l'intervention du représentant de la Banque africaine de développement, je voulais dire que je suis très content de tout ce qu'il a dit, parce que très souvent, le tourisme, on pense que la santé n'est pas importante dans le tourisme. La santé est tellement importante à partir du moment où on parle déjà du tourisme médical, mais il faut dire que le tourisme étant tout d'abord le loisir, mais on ne peut pas aller se reposer quelque part si on n'est pas sûr qu'il y a des infrastructures adéquates pour une bonne santé. Donc c'est pour dire que dans nos différents pays africains, il faudrait qu'on investisse massivement dans les infrastructures de santé, de sorte que dès qu'un touriste va arriver dans un pays, qu'il soit sûr d'être soigné s'il a une maladie. Il faudrait donc qu'on investisse également dans la formation de nos professionnels de santé et que l'assurance, enfin, soit quelque chose de trivial et de disponible dans tous les pays africains. Merci.
Absolutely. Thank you so much for sharing your closing thoughts, Dr. Barnett.
Thank you. I think my last remark really is that if we want to reach last mile, if we are designing to reach underreached communities, we need to design for reality, invest in simplicity, and build trust. Technology is not the destination. It's the catalyst that enables us to do life-saving action. Thank you.
Brilliant. Build trust. Thank you for sharing that, Madam Njide.
So I think my last comment really is that digital tools can only be impactful when there is collaboration and the tools are built together, health tech startups and health providers together. They build it together, focusing on data, being able to harness the data, focusing on quality and the patient outcome, because at the end of the day, the tools are being built to enable better access to better healthcare services. So also listening to my friend from the African Development Bank, when I hear all these billions, how do we ensure that pilots, innovative pilots are taken to scale? Because we find that health tech innovators actually have difficulty accessing growth funds. So I think there is a need to bring all this together in order to make digital tools, really impactful in the
I
center.
totally agree. Collaboration at the very design stage. Professor Stanley Okolo?
I think I would like to end on who owns the data. And this is really important in terms of data accountability, data governance, data security. I think one of the things that WAHO can do for you is in terms of bringing people together, in terms of convening, setting those standards about who owns the data. Let's remember, we're not talking about data for engineering, we're talking about human, people's data, information, health, growth, well-being. Who owns the data? We have to, in order to build trust, ensure that we set the framework at the baseline on in terms of data governance, data security, and this is where the harmonization would happen.
Absolutely.
WAHO has an experience on that. We have done that with pharmaceuticals and it's working very well in the region. That's another area that it can help. Thank you.
Thank you very much, sir. Who owns the data? We need to establish that to build trust. And lastly but not the least, His Excellency Augusto Gomes. Over to you.
Merci, madame. C'est juste pour remercier et réitérer ma conviction que la santé, ce n'est qu'une question sociale, mais aussi économique. Et que pour que la santé soit une santé qui garantisse la vie de toutes les populations, il faut que le privé et le public marchent ensemble. Donc, le financement sur la santé, ce n'est pas une dépense, c'est un investissement. Donc, il faut que tout le monde prenne l'engagement de travailler ensemble pour renforcer le système de santé de chaque pays et de l'Afrique ensemble. Merci beaucoup.
Merci beaucoup, Your Excellency. And please a round of applause for this very distinguished panel for sharing their experiences and remarkable contributions to this topic on digital health revolution in Africa. Respectfully, we recognize that the Honorable Minister for Health in Ghana is here, so please rise so that we take our picture and we leave the stage.
That was expertly done by our moderator, who's even saved some time for us. We have like two minutes out of the allotment, so judicious use of precious resource. Thank you very, very much, Dr. Morris Atoke, CEO, ABC Health Nigeria, our expert moderator. If you're not standing, you're smiling, please. And clap for them, please. Thank you. All right. Thank you very much. Thank you. I've seen some photos of our event on LinkedIn. Please remember the hashtag Whx Leaders for all your photos and your posts that you're making on LinkedIn. Okay, so I'll just give the panelists a few minutes just to get off the stage. We'll clear things up for them, and then we'll continue with our program for day 2. And at this point, ladies and gentlemen, delegates, it gives me great pleasure to welcome onto the stage for our keynote address for day 2 of Whx Leaders Africa right here in Accra, the Honorable Minister of Health for the Republic of Ghana. Let's welcome Honorable Kwabena Minta Akando, MP. Good morning.
Thank you very much, Kafui. Honorable Ministers of Health, leaders of global industry, development partners, innovators, and visionaries, distinguished ladies and gentlemen, good morning. It is an honor to stand before you as we continue the second day of this transformative gathering. Yesterday, we set a powerful tone, one that affirms Africans' readiness not merely to participate in global health conversations, but to lead them. Today, we continued that charge with renewed energy, clarity, and purpose. The world is no longer asking what Africa needs. The world is witnessing what Africa intends to build. In this era of shifting global dynamics, we have learned that resilience is never accidental. It is not born out of charity nor secured through dependence. It is constructed deliberately through sovereign capacity, strategic partnerships, and leadership that places African lives and African priorities at the center of decision making. That is a vision driving Whx Leaders Africa, and it is the spirit that unites us here in Accra. It is the ability to secure the vaccines that protect our children, the diagnoses that guide our clinicians, and the medicines that sustain the chronically ill. It is a confidence that when emergencies strike, our laboratories can detect, our supply chain can respond, and our institutions can coordinate with precision and authority. It is an assurance that our research does not simply contribute to global knowledge, but answers the rare questions facing African families, African health systems, and African development. Across the continent, momentum is building. We are seeing vaccine manufacturing plants rise on African soil. We are expanding the digital architecture that connects patients to providers and facilities to national systems. We are deepening primary health care, widening insurance coverage, and fortifying emergency preparedness. These are not abstract. These are not abstract ambitions. They are grounded reforms unfolding in real time, backed by the political will of African leaders and the ingenuity of African scientists and entrepreneurs. Yet, distinguished guests, if we are to achieve full health sovereignty, our ambition must exceed our progress. We must move further, faster, and most importantly, together. One of the clearest lessons from yesterday's celebration is that partnerships matter, but only the right kind of partnerships. Partnerships that align with Africa's priorities, partnerships that respect national vision and institutional leadership. Partnerships that build our capacities rather than replace them. The Pfizer Accord stands as a compelling example of what responsible partnership looks like. How global industry can collaborate with African government to secure access to critical medicines in ways that are predictable, equitable, and sustainable. This is a type of engagement our continent welcomes. Partnerships rooted in transparency, mutual benefit, and long-term impact. But the conversation cannot end there. We must also address the critical role of research in advancing health sovereignty. Too often, research agendas and sponsored programs are conceived far from the policy tables and communities they aim to serve. The result is duplication, fragmentation, and misalignment. Your Excellencies, going forward, research must be coordinated, it must be directed towards African priorities, and it must be conducted in close partnership with the policymakers and governments responsible for implementation. Sponsoring programs without alignment risk inefficiency and sustainability risk. Sponsoring programs with alignment creates transformation. Here in Ghana, our commitment to this agenda is unwavering. From strengthening primary health care to modernizing infrastructure, expanding health insurance, and investing in local production, our reforms are guided by a simple but powerful principle. Every Ghanaian, whether in Africa, whether in Accra, Boko, Serioso, or Keta, deserves access to timely, quality health care. We are intentionally building partnerships that amplify our leadership and secure national ownership of our results. But no government can build health sovereignty alone. We need innovators who challenge convention. We need investors who see opportunity where others see risk. We need development partners who collaborate, not direct. We need research institutions that generate solutions rooted in our reality and owned by our people. Ladies and gentlemen, health sovereignty is not a distant dream. It is within reach. What will bring it to life is leadership. In action, not in aspiration. Leadership that is committed to coordination, to investment, to equity, and to the dignity of every African life. As we continue our discussions today, let us choose boldness over caution, collaboration over competition, and purpose over rhetoric. Let us forge partnerships that endure. Let us build institutions that last. Let us shape a future in which African health systems are not vulnerable, but visionary, not reactive, but resilient, not dependent, but sovereign. May our deliberation today be ambitious, may our partnerships be transformative, and may our collective resolve remain unshakable as we work to secure Africa's health sovereignty. Once and for all, I'm grateful for the opportunity.
Thank you very much, Honorable Minister of Health for the Republic of Ghana, Honorable Kwabena Minta Kandra MP, for your keynote address this morning on day 2 of Whx Leaders right here in Accra. At this point, ladies and gentlemen, I would like to invite up onto the stage the Minister of Health for Guinea-Bissau with its delegation. Please, Guinea-Bissau, Minister for Health and Delegation, please come up on the stage. We have a brief presentation to be made at this point. Okay, name's up. Thank you very much. Yes, up on the stage. And we would like to invite our speaker who just left the stage, Minister for Health, Honorable Minta Kando. Please come up on stage for us. Ambassador Nancy Sam, please. We'd like to have you on the stage as well. Indeed. Okay. So we have a presentation from Guinea-Bissau to the Minister of Health from Ghana. Okay. So, yes, please go ahead. So this is Pano di Pinti. This is a national treasure by the Guineans. Pano di Pinti is a cultural symbol of great originality and social significance. When you offer it to somebody, it's seen as an honor and a way of expressing feelings such as love, friendship, and gratitude. So those are the feelings that have been expressed by our people from our friends from Guinea-Bissau to you, Honorable Minta Kando, Minister of Health for the Republic of Ghana. Pano di Pinti. So it's a presentation from the Minister of Health of Guinea-Bissau to the Minister of Health of Ghana. Expression of love and friendship and gratitude on day 2 of Whx Leaders Accra. It's a beautiful fabric in the appropriate colors, since our theme is all green. Nice. All right. Pano di Pinti. Thank you very much. Thank you, Guinea-Bissau. We're grateful. I think before you take the plane back to Guinea-Bissau, you give him a tutorial on how to fold it. Yes, Minister, you get a tutorial on how to fold it. Yes, but we're grateful. Guinea-Bissau is still going to be on the stage with us. Ambassador Nancy Sam is still on the stage with us because we have another presentation, ladies and gentlemen, and we'd like to invite the Group Exhibitions Director, Healthcare Portfolio of Informal Markets, to come up on the stage to Tom Coleman, because we have a surprise presentation for you as well. Informal Markets, Tom. Let's put our hands together for Tom. And let's appreciate the team from Informal Markets. They've put together a great show. And it's not over yet, but we're enjoying it. Well, very professional, very well executed. And we have a presentation from Guinea-Bissau to Mr. Coleman of Informal Markets. Pano di Pinti all over again. Because the expression of gratitude and love and friendship still remain. Yes, we unveil. There you go. Congratulations.
Mr. Tom, we want to say a very big thank you, you and your president and your vice president. What you are doing in Africa, we are very grateful. I have no idea in health that you have brought me into this limelight, which is one of the biggest treasures in life and in the world. Your resilience, your persistence to all these ministers, you drive me so hard to the wall to make sure things happen. Burkina Faso is far away from the West Africa. We call them the no man's island, but you were able to make me reach them. They really appreciate you for bringing them here. Even when they were in their worst state, that nobody wants to deal with them, you still reached on them, and they are here. Their president, their ministers, the people of Guinea-Bissau want to show to Informa through you that they are very grateful. Thank you very much.
Thank you, Ambassador Nancy Sam. Many thanks, Guinea-Bissau, for the gift, to the minister and to Mr. Coleman. Thank you so much. We appreciate you. That was beautiful. All right, thank you so much. That was a really beautiful interlude, totally unexpected, but it went down very well. We now continue with our second panel conversation for this morning, and it's on forging strategic alliances, unlocking the potential of pharma, biotech, and research development in Africa. Okay, and here we go with our moderator being Professor Joel Okulo, President, Association of Medical Councils of Africa and President of the Uganda Medical and Dental Practitioners Council. Professor Okulo, your seat is right here. Let's appreciate the professor as he comes up on the stage. There you go, Prof. We now invite the Honorable Minister of Health for Gambia, Honorable Amadou Lamine Samate. Seated to his left is also the Honorable Minister of State for Health for the Federal Republic of Nigeria, Honorable Dr. Isiaq Adekunle Salako. Excellent. Johan Decombe is General Manager, Côte d'Ivoire, Network Head, Francophone West and Central Africa for Roche Diagnostics. Johan, when you're up on the stage, please. Thank you very much. Charles Fojo is the President of the Healthcare Federation of Ghana, also on the stage with us. And finally, last but definitely not the least, Dr. Donald Ibe Ofili, Chief Executive Officer, Medical Laboratory Science Council of Nigeria. So that's our panel. Right there, all we have is Dr. Charles Fojo to join us, Mr. Charles Fojo to join us. All right. There you go. Okay, Professor Okulo. Okay. All righty. Yeah, that comes Mr. Fojo. We can never tire of acknowledging our partners. So once again, our title partners being Siemens Healthineers, Snipe Diagnostics, Roche Diagnostics, and Hologic. Platinum partners, of course, Organon, One Pharma, Al Fahim Healthcare Solutions, Pfizer, Allied Life Sciences. Our gold partners are Daedalus, Nihon, Coden, Pocket Patient MD, DCL Laboratory, Mobile, Health Technologics, and Illumina. Our silver partners, AGD, Hertz Medical, Life Care Technology, Mount Sinai International, Terumo Blood and Cell Technology, Human Diagnostics Worldwide, our friends are AdChem. Our impact partners are ABC Health, Healthcare Federation of Nigeria, PharmAccess, West African Institute of Public Health, beg your pardon, Gates Foundation, Egypt Healthcare Authority, Nigeria Health Watch, our strategic partner, African Development Bank Group, And our venue partner, of course, Kempinski Hotel, Gold Coast City, Accra. Professor Kolo, you have 40 minutes. Over to you, sir.
Beautiful. Can you hear me?
Yes.
Good morning, everybody.
Good morning.
It's a pleasure to be here with you this morning. And as you can see, we have got a very powerful panel. There are two ministers. And that's not very common, is it? And we are pleased to have them here with us. And I'm John Okolo. I'm the president of the Association of Medical Councils of Africa. This is a body that brings together all the regulators of medicines practice in Africa. We have been in existence for the last 17 years, and we do play a very important role in bringing about regulations of medical practice in Africa. And I'm proud to be the current president of the association. And I'd like to recognize any regulators who are here with us this morning to be part of this very important gathering. I have with me, as you have seen, a very powerful panel, and we are going to be discussing the issues of forging strategic alliance, unlocking potentials of pharma, biotech, and R&D in Africa. Now, we have been here the last many hours, since yesterday, and the things that keep coming up is that we have got potentials, we have got resources, we have got human resources, we've got funds, we have got manufacturers, we have got all sorts of facilities available to us. Now, this morning, we are going to unlock. When we use the word unlock, it means something is locked. And these are the guys who are going to help us to put the key in the locks to unlock the potentials that we have, especially when we are talking about transfer of technology to our people. So I've got here with me this distinguished panel who are going to help us in this area that we are going to be talking about. And I want to believe that the contributions that they're going to make this morning will go a long way in improving healthcare systems in this country. So I would like to start by stating that African pharmaceutical and biotech and research sectors are poised for rapid growth. Poised means that they are ready, they are committed, and they are willing to do what it takes to improve healthcare delivery in this part of the world. It also says that we are going to be unlocking their full potentials, not just part of the potentials, but full potentials. And to do this is going to require partnerships. It's going to require partnerships. We are going to collaborate in various areas, bringing our various advantages to the scene. So we are going to have here ministers of health with us, and I think the important point that they're going to make is how this is going to be applicable in the areas of their jurisdiction. I would like to recognize the presence of the Minister of State for Nigeria. I was in Nigeria a few months ago, and we did talk about capacity building in areas of regulations, capacity building in making sure that whatever innovations come our way, we are able to absorb them and do so effectively. So, my first questions I'm going to ask goes to, let me choose carefully, Johan. All right? Now, Johan, the questions that keep coming up is that we have got 54 countries in Africa, and we are trying to forge collaborations in various areas to deliver on what we are supposed to do. So my question is, how can African nations attract multinational pharma and biotech investment to drive technology transfer and local capacity building in Africa?
Thank you very much for the question. In fact, as the scientific landscape in Africa is advancing rapidly, there's a lot of these questions around how do you attract investment in healthcare? How do you attract multinational companies? How do you attract relevant innovation in the healthcare sector into Africa? I would just start by saying that we often hear that healthcare is a cost for society, but in fact, it's an investment for the society. In fact, when we look at it, for $1 invested, analysts usually agree to say that $1 invested in healthcare, you get a return of between $2 to $4, which is an extremely attractive investment from a financial perspective. So what I want to say with this is healthcare is not a cost, it's an investment. Now to your question, how does Africa attract innovative multinational companies? I think the most successful nations that will succeed in attracting multinational investments are nations that have invested in the healthcare system, that is on the way of building a performant healthcare system. I'd like to take another fact that is in 2001, Africa Union nations signed the Abuja Declaration, which entails that every nation committed to invest, and I'll come back again to this point of investment, 15% of the country revenues into healthcare. The brutal fact today is that in Africa, on average, about 5% of the revenues are invested in healthcare. So I think to your question, the first element I would say is invest in healthcare. It's an investment that is worth it, and it's an investment that will attract further investment from multinational companies. The second element I would say is the most successful countries that will manage to attract international investments are countries that are setting up a regulatory framework that is clear, transparent, efficient. And the fourth element I would say is also encourage the regional collaboration. If you want to attract investment, if you want to attract, for example, manufacturing, if you want to attract research and development, very often a single market would not be attractive enough for the big innovative multinational company. But together, if you build some economic regions where you facilitate the flow of products from one country to another, you would increase the chances to attract this international investment. I can build a parallel with countries like the United States or Europe, where you have built these economic free zones, basically. The United States is as its name mentioned it's several states that are united and that don't have all these customs fees between the states. It's the same with Europe. If every nation in Africa, and you mentioned it's 54 nations in Africa, continue with high customs fees across each other, then that is definitely a limiting factor for attractiveness for international investors. Thank you.
I'll move over to Minister of Health, Gambia. You've heard from him that the return on investment for health is quite good, and it's an area that they're able to contribute to. You also talked about the Abuja Declaration, 15%. How is Gambia doing in this area? And importantly also, what incentive is Gambia able to give to these pharmaceutical industries if they come into your country?
Thank you very much. Thank you. Thank you, my colleague, for that beautiful insight. I think we all know the importance of healthcare because for meaningful socioeconomic development, for us to do construction, for us to do whatever in life, we need to be healthy. Otherwise, we certainly wouldn't be able to do so. And I think governments have realized this. And quite a number of governments, including our government at home, has realized this. Of course, sometimes the direct impact might not be seen, the investment point, even from government perspective. So sometimes it's very difficult to convince the finance minister to increase the budget. But I can say with intensifying the intensification of the political commitment, the leadership. I'll give you an example. A few years ago, when we were discussing the budget at the cabinet level, as I argued with the finance minister with regards to our budget, because they capped it up, the ceiling, and the president said health is very important, increase it by 10%. And of course, the finance minister couldn't argue with the president, so they increased it by 10%. So that is that level of commitment. So commitment at the highest political level is very helpful for us to be able to reach. Yes, we are far from the Abuja Declaration when it comes to percentages, because it is percentage-based. But if you, I think we were the last time about 7 to 8%, but if you look at the total volume, the volume keeps on increasing. So that means other sectors get a big chunk. For that reason, the percentage is not 15%. But if everything else stayed that way, that means our percentage would have reached 15% and beyond. Now, those sectors are, road infrastructure and so on and so forth, because we need to invest in those areas. So what that means is certainly the baskets are the same. The same basket services the health sector, water, sanitation, electricity, roads, education, and so on and so forth. So when people talk about domestic resource mobilization, yes, it is important when we put our minds at it. But the basket is limited, because it's the same basket. So yes, with increased commitment, government of the Gambia is able to do quite a lot of health infrastructure investment from our GLF, that's government local funds. And the partners are seeing that and they're coming on board to support. So in principle, we all encourage investment from pharmaceutical companies and other companies, because we all know that the private sector is the engine of development. However, we need to ensure that we have strong systems in country, legislative framework that protects the government and also protects the private investors. And quite a number of countries, including Gambia, is bringing forward robust legislative framework. Like we are working very hard on the new PPP bill, and which will become an act soon, which I'm sure some investors will be interested in knowing what laws are here. Of course, the single window investment is also in place to bring in private sector and so on. But of course, in Africa, many countries, in fact, the whole of Africa is transforming, ensuring increased accountability, and the investors need to know that. Many countries are dealing with the issue of corruption. I must say we need to talk about some of these difficult things. Corruption was a very difficult thing, and that discouraged investment. In fact, some people from elsewhere thought every African country is corrupt. That is not the case. Yes, corruption is everywhere in the world, but we are dealing with it as Africa, and I think it's very important for us to tackle it heads on so that there will be increased confidence and there will be value for money. But of course, the investors also need to help us in dealing with corruption, because for there to be a taker, there is a giver. So let all the investors insist that no bribery. African countries are going for no bribery, and investors need to help us that no bribery in any country in Africa, but they should also be willing to follow the rules. It is when people want to short circuit, then they want to cut corners. But I think with these good systems in place, Africa, the potential is there. Too often than not, the perception also is there. Whether they invest in Africa or not, Africans still go to buy. So why come to invest in Africa? But I think, let us tell them that Africa is grossly underserved. So when they invest in Africa, they will unlock the potential of the underserved. So the market probably is just, what we have today is probably just a quarter of what the potentials are. So we encourage strongly, massive investment in Africa to ensure that there is a win-win for all sides. Thank you very much.
Thank you. Africa is divided into three main economic zones. There's ECOWAS, there's East African Community, and SADC. And here I've got Big Brother from Nigeria, part of ECOWAS. Now, when we talk about what he's talking about, free trade zones, incentives, and so on, bulk purchasing, how can we take advantage of that because of using the economic zones that we have in Africa?
Thank you very much, Prof. And let me thank Whx once again for creating this platform. And congratulations, Tom, for the beautiful presentation from Guinea-Bissau. I think first we all agree that Africa is at a pivotal moment. COVID and the change in the ecosystem of funding for public health not only expose the vulnerability of Africa, but for me it's also a challenge which Africa must sit up to properly address. Again, I would like to also speak about this Africa Declaration. I think this was made over 2 decades ago. And if we made a declaration 2 decades ago, and 24 years down the line, only 4 or 5 African countries out of 54 has met it. I think that it's time for us to go back and review, to take a second look at that declaration, because it may mean the parameters are no longer the same as at 24 years ago. So there's a need for Africa to look at that declaration again. That's the first point I would like to make. The other point I would like to make, which is to agree with my brother from Gambia, is the need for very strong political will, continentally and at country levels, and even at ministerial levels. And I think that initiatives like the African Medical Agency reflects strong political will at the continental level. In my country, for example, Nigeria, we currently enjoy what I would consider a high level of political conviction and political support from the highest level of government, which has helped us in several ways to do a lot of things. For example, if you look at our regulatory agency, for example, the National Agency for Food, Drug Administration and Control, which over the years, with the high support from the highest level of government, has been able to move to achieve maturity level 3 in WHO pre-qualification. That, of course, is very important in attracting investment, multinational investment into the country. And also creating deliberate incentives. The president, for example, of my country, created what is called the Presidential Initiative on Unlocking Healthcare Value Chain, which sits in the office of the president. And the whole essence of that initiative is to create the enablement to attract investment and unlock the value chain in the health sector. So that is a high level of political commitment. Or also the executive order to remove tariffs and make it more attractive for investment to flow in, tariffs on pharmaceutical, active pharmaceutical ingredients, on equipments, custom duties removed. So that's also a deliberate incentive that is created by government to be able to attract international investment in the health sector. So by and large, there's a need for more frontal Pan-African discussion around healthcare, which COVID and the changing landscape has challenged us to do more. And we now need to cooperate more as African brothers, as African sisters within ourselves, coordinate our policies more, align our regulatory frameworks, so that when an international investment comes into Nigeria and comes up with a product and pass the regulatory mechanism in Nigeria, to pass in Ghana should not be stringent again, because we have aligned our regulatory mechanisms. These are very important. Of course, the African Free Trade Zone is another very important instrument that can be leveraged by African countries to help us to attract more investment. It's also important to look at our Africans in diaspora. There are quite a number of Africans, and my country has perhaps one of the highest. And a number of these people have resources, they have expertise, they have networks, that if we deliberately also give them opportunities to come in, create pathways for investment, pathways to ring-fence their funds, to also secure their investment, we can also attract a lot of Africans in coming to in diaspora, in coming home to invest in Africa. In Nigeria, for example, the Federal Ministry of Health, my ministry, works very closely with the Nigeria in Diaspora Commission, which is the agency of government to work with Nigerians in diaspora. So we work very closely with them. We know through them which areas our health professionals are located, and we try to harvest investment through their network. Then, of course, we also need to create national drug policies that provide a comprehensive framework that can promote local production. As an example, in Nigeria, we have a policy that we call 5x5. So if you come into Nigeria, the first 5 years, there's already an established process that within the second 5 years of your coming into Nigeria, you must show clear pathway to start local production. So that is also a very important element to ensure that we work around. So in summary, because I think that we are pressed for time, is to say that Africans, we need to discuss more with one another, we need to align more, we need to relate more as brothers and sisters, and we need to push for strong political will at the highest level. Thank you very much.
Beautiful. I think that's a very good contribution. You did suggest that we need to review the Abuja Declaration. And ever so often we keep coming up with deadlines, health for all by year 2, what was it, 2 what? And then 2030, then there is the agenda, AU agenda of 2063. We keep putting up all those deadlines, and somehow we don't seem to. I don't know what the obstacles are. But let me move over to Charles. Charles, yesterday you talked to us about national health insurance and how it is making medicines and services available to the people of this country. I would like to ask you a little bit more as to how or what systems you'd like to see in place so that those who are in the hard-to-reach areas can get access to affordable medicines.
Okay, so if you allow me just a minute to add a voice to this important conversation around attracting partnership, and I'll answer this one within my time frame.
All right.
I love what China has done. China looked at the population of over 1 billion and saw that they need to solve testing issue, diagnostic, and that it was not sustainable to expect that all testing can be done in the labs. So they started by thinking around, how do we get testing done in the remotest area? And then they opened up and thought about the concept of rapid diagnostic test kits. And then as a policy, they said, anybody who's able to solve it will pay for it. That enabled and opened up the system for the world to go to China and partner with Chinese companies to go into R&D, into RDTs, for any test that is done on the bench in the lab, from CRP, fevers, malaria, not only HIV, like what we are doing, every possible test. And today, China is the world global leader in R&D and RDT production. So it starts from the policy, it starts from giving the commitment to buy and putting resources available to support R&D. That is how Africa we need to start thinking about now. How do we look at our peculiar situation in pharmaceutical? And I love what Nigeria is doing. The 5+5 policy and then the guaranteed procurement is making everybody flood to Nigeria today to say they want to do manufacturing. That is how we want to do. So Ghana has a very good, thank you. Ghana has a very good primary healthcare system. So we have an excellent national health insurance scheme that is today providing free healthcare for 60% of the people. So that means that no matter where you are, if you are on national health insurance, the healthcare will be paid for free. So that becomes the gate opener that we are supposed to leverage on to be able to provide solutions into healthcare for first, which include that if we can site the appropriate hospital, mostly ideally by a private sector person, in any remotest village, and the person accesses the health is for free, then that means that you, the owner, you'll be paid. If I go into manufacturing of medicines in Ghana, I know that no matter where there's a health facility and the medicine is given, I'll be paid. If I go into diagnostic, no matter where it is, it will be done. If I go into setting up of labs, no matter how remote it is and it is utilized, I'll get the free care. So this policy has opened up the opportunity for private investment. And it is time that we take advantage of it. And that is what we are trying to do, that we in private sector, these solutions must be provided by private sector, not the government itself. This is why we see ourselves that how do we mobilize funding, financing? How do we open up and say the Ghanaians are ready to partner the rest of the world to go into setup of private hospitals, production of RDTs, production of medicines, because of this government enabling environment. That is where we can get access to the remotest area, because when we do it, there's guaranteed payment, there's guaranteed offtake.
Donald, you heard what Joanne said. They are looking for partners. They are looking for infrastructure so that they can be able to invest. Now, diagnostics is one of the key areas of service delivery. And how can you and research institutions, research organizations come together and collaborate with investors to ensure that we have adequate supplies of diagnostics, we are doing research, appropriate research with the diseases in our countries, and therefore making investment relevant to the healthcare needs of Africa?
Thank you so much for that beautiful question. On a personal note, I'm so proud sharing the same section with my Honorable Minister of State for Health. Thank you, sir, for your leadership and for all you do. That is a very brilliant question. I would say that the potential has always been there in Africa for manufacturing of diagnostics. If you go back to about in the 70s, take for instance in the 70s, in the 60s, the manufacturing of the smallpox vaccine used to combat smallpox in Nigeria, for instance, were manufactured by Nigerian manufacturers, scientists. They were not imported. They were manufactured in Lagos Yaba laboratory. So the potential has always been there in manufacturing. All we need to do is to trust ourselves the more. No investor will come into Nigeria or in Africa to invest if we ourselves don't have trust in what we are doing. And we need to bring in the academia in this conversation. A lot of research findings are sitting in our libraries without utilization. So if we begin to trust what we are doing and we encourage ourselves to start from where we are now and begin to manufacture, then investors will trust what we are doing in our economies and now begin to come and invest and partner with our entrepreneurs. Take, for instance, what is happening in Nigeria, the Dangote refinery. Before now, much of the petroleum products used in Nigeria were imported. But Dangote established a world-class refinery in Nigeria. Now we are self-sufficient in petroleum products. We no longer import as we used to import. A round of applause for Nigeria, please. So now the same thing can play out in the area of diagnostics. And WHO have really done a good job in focusing on diagnostics in the World Health Assembly in 2023. Now the enabling environment is there. The policy, supporting policies like the policy of Federal Government of Nigeria 5+5 is also a very good one that can also be replicated in other countries to ensure that with the enabling environment and the right policies, that manufacturing can thrive in the continent. With a very huge population and still growing, take for instance, the population of Nigeria is over 220 million, the market is here. So with the huge population and the willingness of governments to do pool procurement, I think this is the right time for partners to come into the continent and begin to partner with the entrepreneurs to already have them on ground. So if you have the enabling environment and the right policies and the academia are also ready to really invest in development, the funding is coming from government, especially in funding research and development, that will also help the ecosystem in terms of manufacturing and R&D. Thank you.
Thank you. There are two important events that have happened in the last year or so. That is COVID-19, which brought a lot of challenges on our healthcare delivery system, and also the freezing of USAID funding. Minister Gambia, what do you think has happened to galvanize collaborations in the era of these changes that I've just mentioned?
Thank you very much, Prof. I think the coming into the world of COVID-19 has really changed the dynamics. It has exposed the serious weaknesses in the health systems throughout the world. Africa certainly not left behind. Gambia as well. We did our best. We identified the gaps. But I think what it has pushed us to do is to do quite a lot of health system strengthening. Now, looking at even the ICU beds in Gambia, very little. But the resources we got from partners like the World Bank, we decided to construct a state-of-the-art emergency treatment center, which has 104-bed capacity and 20-bed modern intensive care unit. Because too often than not, our countries get a lot of support when there are crises, But 5 years down the line, 10 years down the line, you don't see the impact. We didn't want that to happen to Gambia. So we decided to invest in healthcare infrastructure. The soft areas, a lot of countries can do for themselves. But when it comes to capacity building, which is medium term, infrastructure that will last for 50 to 100 years, those are the difficult areas, and we decided to tackle those heads on. Now, coming back to the opportunities. The COVID-19 has taught us that the problems were there. Manufacturing in Africa was a problem. Supply chain disruptions were a big problem and a big threat. Then we decided to come together at various levels, continental levels, and people are talking about full procurement and so on and so forth. But in the same vein, if we have investors invest in Africa, I think the truth of the matter is there's enough liquidity around the world to really make a difference elsewhere. Some of those funds are stuck, lying down, and not being used. And the need is there in other countries. So what I think investors, I'm talking as a layman, but what I think investors should bring on the table is, look at the volumes. My brother spoke about the volume even in Nigeria alone. You talk about West Africa. My colleague, brother minister from Nigeria also mentioned it, West Africa. You look at the potential that has not been tapped. And those people also need high quality medical services. So we urge investors to come, probably because the volumes are so large, the cost should be competitive. So bring down the cost, the market is there, and even if the profit margins are minimal, multiplying that by the millions, they will still, get the value of their investment. So sometimes the cost also affects the African countries because we do not have much of those finances. But balance it, look at the market, bring down the cost, and then invest, and then, all sides will be winners. Thank you.
Thank you. John, you have heard the reassurances that you have from our colleagues in the Ministries of Health and research organizations. Has it moved you to move?
Yes, in fact, we are in, so our company is a multinational company, absolutely. Our investment in Africa is not new. In fact, our company, we have 400 employees that are working every day in Africa. We have invested in training centers, so I've heard the building of capabilities. This is absolutely something that we have invested in. We have manufacturing in one country in Africa. And when it comes to diagnostics in particular, we have teams of technical engineers that are disseminated across the continent to ensure that the diagnostic solution work continuously. Now, I think the next steps for me in healthcare, we often talk about manufacturing, attracting manufacturing. I think even above that is attracting research and development. The true value in healthcare is the innovation you can bring. And I think there's a fantastic chance in Africa in the sense that most of research and development today are run on populations that are outside of Africa. And we know that different genotypes have an importance in the efficiency of the treatment. And this is, I think, a big untapped potential in Africa, is to develop clinical research. And to do this, I come back to the point I was making earlier. I think it is very important to have this investment mindset in healthcare, invest in labs that would make possible clinical research for the greater good of the African population and also for the African economy.
Thank you. Our time is running out. I would like to ask the panelists one sentence parting shot. Charles.
Africa cannot do it alone. We need companies that are into innovation, because their innovation is what the local manufacturers will be producing later on. So as we focus on innovation, let us continue to court innovation companies to always give us the future products that our local manufacturers will continue to manufacture.
Thank you. Donald?
Africa should take advantage of the potential of the African Continental Free Trade to liberalize trade in Africa. Thank you.
Beautiful. Minister?
Thank you. My parting shot will be to also invite a lot of attention to development of our phytomedicine resources. We have a lot of resources in Africa that are left undeveloped, and I think that this is one area that we also need to focus on. Thank you.
Thank you. Mr. Gambia?
Yeah, thank you very much.
One sentence.
Yes. Where there is a will, there is a way. Coming together, we can do it. So let's work together.
Yeah, for me, the biggest wealth of Africa is its population. And to protect the health of the population, we need everybody. So we need multinational investors and we need governments working together.
Beautiful. Let's put our hands together and thank this panel. I think they have been able to cover a lot of ground, and I think the exposition that they've given us should give us that vim to get together and collaborate and make Africa great again. Thank you. You want to take our pictures?
Yes. Thank you very much, Professor Kulu, for doing a masterful job of teasing out the issues on the topic that you discussed, forging strategic alliances, unlocking the potential of pharma, biotech, and research and development in Africa. Thank you very much. Let's appreciate them one more time. The good news is that for those of you who are hungry, there's only one panel between us and lunch. But before that panel, I'd like to invite Ambassador Nancy Sam up onto the stage. In case you don't know, she's the local coordinator for the Whx event here in Accra. Ambassador Sam, let's give her an ambassadorial round of applause. We have a presentation to make this, it's almost 12, so it's still morning. And we are making this presentation to the President, Middle East, India, Turkey, and Africa for informal markets, Peter Hall, and it will be accepted on his behalf by Mr. Tom Coleman. So Tom, please kindly step up to receive this presentation from Ambassador Nancy Sam for Mr. Peter Hall. And in case you're wondering what we're presenting Dr. Bennett. From the Office of the President, Dr. Bennett, please, we'd love to have you up on the stage. Dr. Bennett? Dr. Bennett? Dr. Bennis from the Office of the President, we'll be happy to have you up on the stage as well. Dr. Bennis, thank you so much. So Ambassador Sam is making a presentation of premium Ghanaian chocolate to Mr. Hall, appreciating and showing gratitude and love and support. Yeah, there you go. Ambassador Sam. Could we kindly have the Vice President of Informal Markets up on the stage for us? Thank you very much, Vice President. Thank you. Happy to have you here. Thank you.
The Vice President of Informa, a lady, a hardworking woman who had been to Ghana before this meeting. She flew herself with her team, came like a chartered plane, just 4 hours, came in the morning, within the next 4 hours, she flew back, just to be sure that this meeting would be real. And I was surprised, because you can't come into Ghana all the way from overseas and leave in 4 hours. She did that. This shows how serious this company, organization is. When they are doing things, they do it well. But we can't let you leave Ghana without tasting our premium chocolate in the whole world. This is the best. And Ghana chocolate is the only chocolate you can hold it under the sun and it will not melt, because it is 80% cocoa, and our cocoa is the premium. And Ghana is the second largest producer of cocoa in the world, and our cocoa is the premium. So as you taste it, you see the difference. You bite it and it's not soft, it is hard, it is crunchy. And I know that when he takes it there, all his staff, all the team will ask him, can I have a bite? Please, you can share it with them. But make sure you don't give all to them, because your family in the house will also want to taste Ghana. Thank you for all that you've done for West Africa. Thank you for what you are doing for Africa. And we are very grateful. And I want to share something that you'll be very appreciative. They supported Ghana. Every minister you see here, they paid for their ticket to come. Every foreign speaker, they paid. They have taken care of us. They supported Ghana so well. Our president said thank you. Our minister said thank you. All the ministers that came, they said thank you. It's not just coming to Ghana, but making sure that they had that connection to meet Pfizer, to meet Roche, to meet Bill Gates Foundation, to meet Siemens, Human. These are gigantic big companies, I mean multi-million-dollar company, and for us to bring them down here to meet all the ministers, it is not a joke. We really appreciate you. Thank you very much.
Thank you very much, Vice President, and thank you, Tom. I'd like to also call up on the stage Solen, singer. That's it. Oh, there she is. Okay. All right, Solen. Okay. All right. So one for the president, one for the vice president. Thank you very much. Please, Ambassador, please stay, because Solen would like to make a presentation to you as well. Yeah. So Solen will now make a presentation of a memento to Ambassador Sam, our local coordinator for the Whx event. There you go. Solen, to Solen. To Solen.
Ambassador Nancy, this is a presentation to you for all the hard work that you've done in the last few months since that meeting, that 4-hour meeting in Ghana. I don't think this event could have taken place without your support and collaboration. For us, this week has been a huge success. I've thoroughly enjoyed every moment. I thought the presentation from His Excellency the President and the Minister were absolutely fantastic and really have set up the scene for all of our future events in Africa. So thank you to Ambassador Nancy, thank you to the team for all the hard work, and thank you for coming these last couple of days. I hope it's been fruitful for you. And we will soon announce the next Whx Leaders and where it will take place. But thank you again, Ambassador Nancy. It really couldn't happen without all your dedication and hard work.
Thank you, Solen. Thank you, Tom. Thank you, Ambassador Nancy. Wonderful. Thank you very much, Solen. Thank you very much, Ambassador Nancy. Thank you. We appreciate you. Okay, ladies and gentlemen, we are now going to go into our last panel for the morning session. And this is on the silent epidemic confronting the rise of non-communicable diseases in Africa. Our moderator is Dr. Francis Ohaniyido, Director General, West African Institute of Public Health, Nigeria. Dr. Francis is going to sit here. And then we have our panelists being the Honorable Minister for Health and Public Hygiene from Senegal, Honorable Dr. Ibrahima Sy, to join us right there in the middle. We also have the Honorable Minister of Health from South Sudan, Honorable Sarah Cleto Rial, right in the middle there with next to Ambassador Sy, Honorable Dr. Sy, I beg your pardon. We have representing Siemens Healthineers Middle East and Africa, Ibrahim Balou. Representing Accord Countries Access and Engagement Lead for Pfizer is Ismahene Ben Mehidi. We also have Dr. Modupe Elebhute Odumsi, co-founder and Chief Executive Officer of Marcel Ruth Cancer Center and Specialist Hospital in Nigeria. And last but not least, we have Vincent Chen, Head of Global Marketing, Naib Company Limited, one of our partners, to be with us for this conversation. So we'll have our moderator, Dr. Francis, closest to me, and in the middle we'll have Honorable Minister of Health for Senegal, Honorable Minister of Health for South Sudan in the middle, Honorable Sarah and Honorable Dr. Ibrahima Sy, and then the rest of us will seat ourselves accordingly. Is that Dr. Francis? So we're missing Dr. Clara, Honorable Sarah, I beg your pardon, Honorable Sarah Rial, Minister of Health for South Sudan, and we have our presenter here already. All right, there she is. Okay. Good. Okay. There's one more seat here. Yes. There you go. Yes. So, Dr. Francis?
Good afternoon, everybody.
Good afternoon.
Good afternoon, all. It's a pleasure to be with you. Sorry, I'm a bit breathless. I'm just coming from another session, a round table next door, so I had to rush in. But I think for this session, as you can see, the title of the session is Confronting the Rise of Non-Communicable Diseases in Africa. And I think it's no longer gainsaying that I think most people in this room, in one form or the other, you have relatives of somebody you know who is battling with one form of non-communicable disease or the other. It could be hypertension, it could be a form of diabetes, and all whatnot. And one of the problems with non-communicable diseases, I think we need to first and foremost understand is that a lot of them have long-term costs. And most of the developed countries or high-income countries, they are battling with them, and a significant chunk of the spend
on their health system resides in what they put into non-communicable disease management or long-term care for them, you know, and so it's very significant for us. And Africa is beginning to experience a spiral of non-communicable diseases. Initially, we were talking mostly about communicable diseases in one form or the other, you know. But the problem there is that we've also battled non-communicable diseases for a while, and significantly, but it has always been like a tip of the iceberg phenomenon. Because why? Because the colonial construct was such that most of the colonialists of the continent didn't want to spend on non-communicable diseases. They were more interested in making sure they themselves stay alive on the continent. Sorry to say that, but that's the truth. So because of that, if you look at development sector spending in terms of what the partners bring into countries across the region, you find out that very little emphasis is given to non-communicable diseases. So I think based on that, I think the conversation today is going to reside with us here to see what are the key issues in terms of non-communicable disease on the continent and how we think we can do better in terms of reining in the non-communicable disease burden that is building up on the continent. Some people talk about the double jeopardy for us, communicable and non-communicable diseases. So I want to welcome my able panelists here today, and I think from the smile on their faces, I think they are going to do justice to this. But before we start, if you've had any relative of yours that suffered non-communicable diseases, can you raise your hand? One form or the other. Okay, I will not ask you what they suffered. But so we're in agreement that it's a problem across board. So on that note, we can start. We have a very fantastic and eclectic group here, and I think we start with my sister. Elebute, don't see, right? Yes, so Doc, let me start with you. In terms of outlooks, so for us, one of the things that has challenged us is what do we see as the biggest health system gap on the continent in terms of managing non-communicable diseases?
Good morning, everybody. I think the mic's working. Thank you so very much for having me and for the opportunity to be on this panel. A very important question, and I think that we need to go back, although I work in the sort of tertiary, quaternary healthcare systems, running a private comprehensive cancer hospital in the UK, but obviously started my career in internal medicine for quite a number of years. And I think that we need to bring this story back in terms of bridging this gap to the very beginnings. There's a huge issue with the paucity of education and awareness amongst our population. Just the fact that if you don't go and see a doctor on time, if you don't have your wellness checked regularly once you're above the age of 40, and so on, then you are at risk of having problems from a certain non-communicable disease. The way I talk about them when I give talks is that these are the silent killers. These are the things that you may not have any symptoms, you may not have any problems. So unless you preventively seeking health care on a regular basis, you could miss this. So one is education and awareness. The second big ticket item is healthcare screening. And I think one of the things that resonated with all the panels and all the discussions about how do we improve healthcare systems in Africa, how do we leverage on funding, how do we leverage on infrastructure, and in terms of people's skills. But screening, as far as non-communicable diseases are concerned, screening is huge. If we don't screen our population on a regular basis, if we don't have standards and guidelines for our countries that almost insists that when people get to a certain age, when their risk is higher, they get screened, we are going to forever be on the back foot trying to treat patients who are presenting with advanced problems. And then, of course, we come to the lack of infrastructure, we come to the problems in terms of difficulty with diagnosis, because we have not got the right instruments and the right laboratories and the right, actually the personnel, the skills to make this diagnosis. We don't have the correct referral systems from And then finally, I think data. The last panel spoke to everything that I think about. Data is key. We need to know what the denominator is. When we were trying to set up Marcel Root Cancer Center about 5 years ago now, we were 5 years last year, we could not tell, nobody could really tell us what the numbers of cancer patients were in Nigeria. We have no idea, really. We have WHO Global data from years ago, but we don't really know what's happening. So we need to bring it back to, again, having cancer registries that are actually being accurately filled so we can have data. And what we've tried to do at Marcel Ruth, and as I said, we've now been open for 5 years. We've seen over 5,000 patients at Marcel Ruth in our 5 years. Children, about 50 or so with different cancers, as well as adults, is that we built a comprehensive cancer center where everything is under one roof. So we're doing screening programs, but we're also treating the patients, providing all the treatments that are available, both surgery, chemotherapy, radiotherapy, all under one roof. But we also make emphasis on going out to the community, on speaking, on raising awareness and education programs. We're also training. We've been accredited. We're the first private hospital in Nigeria to be given accreditation to run an oncology residency program, which we're doing. But we're also training the radiotherapists and the physicists and pharmacists and providing all these skills that people require. We have a foundation. We also have a support group for our patients. But more recently, we've developed a research and development team who are now working very closely with pharma, and they've gotten accreditation to run phase 2, 3, 4 clinical trials, and to also, and we also have our own registry. Okay. So a comprehensive cancer center can provide all these things, but in terms of the population, it has to be population-based education and awareness, as well as the screening programs.
Okay.
Thank you.
We'll hold it there. I'll come back to you, and sorry, I'll come back to you. So she has set up an interesting conversation in terms of looking at what the gaps are within the health system, you know. So I think I'll just take it in order of the panelists around here. So Sarah Claytoriel, right? Did I pronounce your name correctly? Okay, so in another life I was probably Sudanese, right? South Sudanese, yes. Okay, so madam, it's good to have you on the panel. I think for us, one of the biggest things around NCDs has been how do we develop the right strategy for NCDs? Because, of course, there's a learning curve. Most of the developed countries have one form of strategy or the other. But from your own side, you know, I think we also have to contextualize that certain parts of Africa have some fragility in one form or the other. And South Sudan is a young nation, and you're battling with a lot of things, including even humanitarian context, you know. So from that purview, what does an achievable, non-communicable disease strategy look like? Build a picture for us. Sorry, the mic is there.
Thank you. My colleagues who are here, distinguished partners. Yeah, you mentioned there about South Sudan being a young nation and going through so much challenges. And I think this is going to be really a very good example to use how we can, what does an achievable NCD strategy look like? So we have heard the sobering assessment. Our NCD program performance stands at 41.84 percent for the year 2024-2025. This means that we as South Sudan, we are still not on track, and this is not a moment of despair, but we'll have to find decisive, or get to decisive clarity and action. So there is an urgency, and this discussion is the right time now to talk about it. So let's answer some of the core questions with even greater precision. Is our challenging, fragile context, in our challenging, fragile context, what does an achievable NCD strategy looks like? So it looks like a strategy that directly attacks the bottleneck just outlined, while being ruthlessly pragmatic and build on our homegrown successes. It is not a new parallel system, but it is the intelligent integration of the NCD care into the resilient platform we are already building. So let me reframe our actionable path through the lens of our challenging and proven model. One is talking about decentralization and integration at the point of care to overcome fragmentation. So we must move beyond piloting, and we will scale up. So the action that we need to take as South Sudan, we will scale up the PEN-M package from only 3 primary health care centers and then to all high burden facilities. So these are starting in the states. We have 10 states and 3 administrative areas. So we want to start with the states that has a strong governance. If you're familiar with South Sudan, it's the Lakes states and Central Equatorial states. And how do we do that? By equipping these centers with the basics, blood pressure cuffs and glucometers, and as you mentioned, training our frontline workers, our community leaders. So we integrate the screening into every patient contact, just as in those 2 states, they integrated diagnostics into outbreak response. And this helps to challenge the access and fragmented services delivery head on. Another approach is to empower our community networks to bridge the awareness and care gap. The action that we are taking, we'll launch a targeted public awareness campaign through our community structures. We are training our boomer health workers, which is our community health workers, and this has been done successfully in Juba, which is the capital city, and also in another part of South Sudan, in Ropkona. What they did is to conduct NCD risk factor education, trace defaulters, and support adherence. And how this is done is distance our greatest asset, community trust. Usually when hospitals go to the community, people, they run away. So it's good to use the community leaders, those who are in the community, because they listen to one another. So we turned the community trust in a tool for prevention and management, directly addressing the critical bottleneck of low public awareness and weak follow-up. We also leverage and strengthen simple digital tools to fix our data crisis. So it's basically what you're talking about, but we're putting it in practice in South Sudan. So the action that we're taking, we cannot manage what we cannot measure. We must immediately adapt the eServe companion app. This one is used in Lakes State to include a simple NCD module for patient registration and defaulted tracking at the PHCCs. And how we're doing that, we create a foundational data We lack on hypertension and diabetes prevalence and outcomes. So it is the first essential step toward a functional cancer registry and a stronger health information systems.
Okay.
Yeah, and I think there's talking about a fragile state. I think there is a lot to share, and I don't want to come all the way from East Africa and not to share with all of you. So I will try to summarize some of the things that we are doing. Yeah, we also starting to focus with a phased approach anchored by secure financing and commodities. Again, also building on existing systems.
Can we hold, Madam,
with a stronger governance? Yeah.
Can we hold that?
Yes.
Because of time, we'll come back. So we'll go into the details. It's sort of like a small, short deep dive on that.
That's okay.
Because it's very critical. I'm happy that you actually the strategy by looking at the layers of the health system. I'm particularly happy that South Sudan is looking at primary health care as a foundational. Because if we miss that, a lot of countries have not really wrapped their head around the idea that it's foundational, that whatever you do, there must be identifiers at primary health care level that will be able to bubble up. Because most of the issues are actually a tip of the iceberg phenomenon. But I didn't hear much about, maybe we'll come back to you, about the idea of NCD literacy, community literacy for NCDs. I think is critical, and possibly even the role of low-cost tech to help drive that agenda. I think it's something a lot of countries need to really look at. Well, I'll come back to you. I have my good brother, the Honorable Minister of Health from Senegal. Bienvenue, monsieur. Yeah. So, Doctor C, I hope I'm pronouncing your name correctly. Ibrahim Assi. Okay, so Doc, Monsieur Médecin, the question I have for you here is, when you look at NCDs, one of the things we will quickly ask you, how are we going to finance it? And because that's no-brainer, because already you are battling with so many things on the continent, so financing becomes a very critical pillar of the health system in anything we're introducing within that system. So for us, we would like to, I think the generality of people here would like to know, in terms of Senegal's NCD response and the lessons you've learned around financing and scaling up regionally. I know Senegal has done some work around that. Please, can you share with us? I think he's going to speak in French, so please, I don't know if you are mic'd up to receive the interpretation for that. So, monsieur.
Merci beaucoup, monsieur le modérateur. Permettez-moi aussi de saluer toute l'audience et de remercier les organisateurs. Vous avez vos casques. D'accord.
Sorry.
Okay.
Sorry. Continue.
Donc, nous savons tous que les conséquences des maladies non transmissibles sont multiples, ils sont profondes, et concernent l'individu, concernent la famille, la communauté et l'État. Et si je prends l'exemple du Sénégal, aujourd'hui, 53% des décès sont liés à ces maladies non transmissibles, mais avec un taux de mortalité prématurée de 22%. Si on prend en termes économiques, à peu près, nous avons 324 milliards, soit 46% des dépenses courantes en 2022 et 262 milliards, soit 45% des dépenses courantes en 2023, qui sont liées à ces maladies, à la prise en charge de ces maladies non transmissibles et qui proviennent essentiellement des ménages. Donc cela montre un peu le problème aujourd'hui de prise en charge de cette maladie, de ces maladies-là, qui sont sous-financées souvent dans nos programmes, il faut le dire, dans nos budgets, mais aussi sous-financées par les partenaires techniques et financiers. Mais il me semble aujourd'hui opportun qu'on puisse changer l'approche. Vous savez, souvent, on a développé l'approche One Health. C'est les maladies, comment agir sur les maladies zoonotiques, la santé humaine, la santé animale, la santé environnementale. Si on a cette même approche au niveau des maladies, maladies non transmissibles et maladies transmissibles, pour développer cette vision de soins qui sont orientés sur l'humain. Ça veut dire de savoir quand on soigne, quand le système de santé soigne, on ne soigne pas une maladie, mais on soigne un humain qui peut être confronté aux deux types de maladies, maladies non transmissibles et maladies transmissibles. Et c'est un défi, c'est un challenge que les systèmes de santé dans nos pays doivent régler. Mais aujourd'hui, comme on est confronté à un problème de manque de financement, le principal plaidoyer que moi je fais, c'est de voir aujourd'hui comment on peut accroître la part du budget réservé à la prise en charge des maladies non transmissibles, parce qu'il sera la charge de morbidité la plus importante en termes de santé publique aujourd'hui et demain. Mais il faut aussi voir comment orienter nos discussions stratégiques avec nos partenaires techniques et financiers pour qu'on puisse intégrer aussi des packages de soins à côté des maladies transmissibles. Il faut aussi qu'on voit comment, du point de vue domestique, au niveau de nos pays, comment lever des financements avec le secteur privé pour qu'on prenne en charge ces maladies-là. Parce que l'économie est nourrie par le secteur privé. Et ce secteur privé a besoin d'avoir un capital humain solide, avoir des personnes qui sont en bonne santé, qui peuvent développer des activités et qui peuvent contribuer à la consommation et à la productivité. Donc, il doit y avoir un petit retour sur l'investissement qui va bénéficier à la prise en charge de ces maladies non transmissibles. Maintenant, le point, après le plus important pour moi, c'est l'assurance. Il faut que nous tous, que nous soyons conscients que nous sommes exposés dans le temps à ces maladies non transmissibles et on doit payer pour nos dépenses de santé futures et amener la population à adhérer à l'assurance obligatoire. Sinon, ce sera une maladie qui va décimer les pauvres au moment où les riches ont de l'argent et ils peuvent prendre en charge leur propre santé. Et il va falloir, dans nos pays, qu'on trouve des mécanismes qui puissent permettre aujourd'hui de prendre en charge cette question, surtout à travers l'assurance. Mais aussi, pour terminer, de développer cette option que nous avons au niveau du Sénégal en disant qu'on va promouvoir ce qu'on appelle la santé dans toutes les politiques. Et cette santé dans toutes les politiques, elle est orientée vers la prévention et la promotion de la santé qui prennent en charge ces maladies non transmissibles pour que le ministère de l'Éducation, le ministère de l'Environnement, le ministère de l'Hydraulique et de l'Assainissement, même le ministère des Finances, le ministère de l'Économie, tous puissent avoir un budget qui puisse aider à prendre en charge ces maladies non transmissibles pour qu'on puisse avoir quand même des ressources humaines de qualité qui puissent supporter tout le capital de travail dont nous avons au niveau de notre pays.
Merci, ministre, honorable minister. Je parle un peu français, pas de l'utiliser, but I had a general understanding of what you were saying, honorable minister. So what he points, honorable Ibrahim Assai has been saying is actually that they started a journey, and it's quite recent in Senegal, in terms of trying to have like a sort of roadmap or a mechanism for tackling NCDs in Senegal. And one of the key things they did was they wanted it to be evidence-based. And because of that, they had to make sure that they had some basic foundational research or understanding of what the issues are. Like I pointed out earlier on, they found that it was like a tip of the iceberg when they now started finding out. And in order to drive that agenda, they needed to make sure that the mechanism had private sector fully on board. And one of the things they did, I hope I'm right in terms of my understanding, is you got the telecom sector to be part of it and made sure that it was a multi-sectoral thing with the Minister of Economy, Minister of Health, Minister of Environment and the other, it has a more sectoral push around it, and you've been able to get like a sort of roadmap for the country in terms of how you will approach it across the regions of Senegal. You know, so I commend you on that. I think that is something worthwhile, and I think it builds on what my sister from South Sudan was talking about, Madam Clayton. So I think we'll hold it for now because of time, and we'll go to my brother, Balut, right?
Yeah, Balut.
Ibrahim Balut. Ibrahim, so in your case, from all you've heard, what do you think should be a critical thing that we should do to engage NCDs in Africa?
First, good evening, good afternoon, everyone. Thank you for having me today. I think the most important tool in the prevention and acceleration of prevention, detection, screening, and treatment of NCDs is the digital tools. And I believe I'll just give you a few data on the importance of digital tools and why. By 2030, NCDs will kill more Africans than malaria, tuberculosis, and HIV combined. So the problem is not a future problem anymore. This is a problem that is happening now, and the impact is knocking on our doors. How do we move from a state of a reactive approach to NCDs to a more of a preventive and approach to NCDs? The solution lays in digital solutions and how we can implement them, because digital solutions will give us that visibility, and there are many layers in terms of digital solutions on how we have spoken about strategy, we have spoken about data, we have spoken about the burden of disease in Senegal, and when you ask the question, everyone raised their hands. It's happening to everyone. As a layer one, the most important thing that we need to do is building an NCD registry in Africa.
Yeah.
Because you can't treat what you can't see. You cannot improve what you can't measure. So building an NCD registry is very critical for each and every country. To get that visibility, to understand the scope of things, to understand the impact, and to understand also the patient pathway from the detection, and you spoke about capacity building, and you spoke also about treatment. The second layer that comes is related to digital AI solutions or teleradiology as well, because we've seen in many countries across Africa that even if the equipment is there, especially in rural areas, especially in remote areas, you don't have the human capital that is enough to operate and detect and to help these remote communities. So how do you do it? How do you bridge that gap? There are many solutions now available that range from teleradiology to telescan as well for imaging and for screening programs and for detection, to many AI solutions for fast detection or autonomous detection of diseases, which I think is very important for African countries to understand and implement.
Okay.
And it's very important because it will help us really bridge the gaps that we have in the system. But we need to change a bit the mentality when it comes to digital solutions. That, again, I think my colleague yesterday from Siemens, we spoke about that it's not a cost, it's an investment, because this will help us first understand the scope of things, the scope of diseases, the burden of diseases in our country. This will help us implement the right tools, and then digital solutions will help us connect the healthcare system all together. It will help us connect the hospitals. It will help us to connect. Yeah.
Thank you very much. We'll hold it there and see if we can complete with the other speakers. The next speaker is Mahen, right? Did I get it right? Is that the pronunciation for him?
Yes.
It's Mahen. Mehdi, Ben Mehdi.
Ben Mehdi.
Ben Mehdi. Are you Moroccan?
I'm Algerian.
Algerian, okay, Ben Mehdi. So Ben Mehdi, you are your engagement lead for Pfizer, right? The multi-country engagement lead. Okay, so from your own side, looking at your work, following up with what Balu talked about, what are the practical steps that pharma can take to be able to strengthen access to affordable NCD medicine on the continent? You know, so we have very limited time, so let's just...
Thank you so much. And thank you for the opportunity to join this very important conversation. And obviously, public-private partnerships are great opportunities for government and industry to collaborate together to enable better access to healthcare for patients living with NCDs. But that goes through major elements that we need to take into consideration. And first, it's about making the medicines sustainably available, not just periodically. It's really about reliability on having access and disrupted access to medicines. It's also about strengthening local capabilities, because it's not just about having the medicines or supplying the medicines. It's really about having those who are there to dispense the medicines able and supported in education and training to be able to manage the patients. And last but not least, it's also about working together to co-create with the Ministries of Health and design patient-centric models that would integrate the screening, the diagnosis, the treatment, and under one umbrella, and have this holistic approach of the management of patients living with NCDs. As an example, I would like to quickly share with you the work that we do under the Accord for a Healthier World for Pfizer. It is a very innovative initiative that was launched on mid-2022 with the aim of closing health equity gap for 1.2 billion people across 45 countries where we have most of the patients in need, the most vulnerable populations, right? And just so you know, more than 30 countries among these 45 are here in our continent.
Wow.
How do we work? First, as I mentioned, we give access to all Pfizer medicines, all of them, the essential medicines and the most novel breakthrough therapies to the patients at a not-for-profit cost. So we make affordability a reality. We make it also consistent through a long-term partnership. But we also support local capabilities by working with the government, with the medical scientific societies, with the scientific communities in order to train and educate healthcare professionals, inclusive of physicians, nurses, pharmacists, and make sure that those educational platforms are going to equip them into better managing patients suffering with different diseases, including NCDs. And so far we have been able to work with more than 8,000 healthcare professionals in just a couple of years, which is just incredible, and giving access to hundreds of thousands of patients through the program to the medicines that today are saving and changing patients' lives. Just as a conclusion, I would like to add that it's not just about making medicines available. This is not enough. This cannot solve or close the gaps that we see within NCDs. It's really about true partnership, a partnership that really offers to government the sustainability that allows them to plan ahead, but also creating affordability that doesn't compromise on quality.
Okay. We'll stop there for now. Thank you very much. So, Chen, Vincent, you head the global marketing for SNIDE, right? So I'd like to ask you, what innovation in diagnostics should be the greatest, or holds the greatest potential for the continent in terms of how we follow up with NCDs and improve the visibility for the population across the continent? What are your thoughts about that? So quick.
Thank you very much. And in my point of view, the affordable, clear solution is a very vital innovation to the non-communicable disease, because for example, like infectious disease, usually we use the molecular diagnostic, but for NDC, and we use the immunoassay to detect the disease. Actually, In the past, a lot of laboratory, we used the last generation of immunoassay to detect this kind of disease, but it is not so accurate. But for the for these few decades, and we together with a lot of major manufacturer, we developed a clear solution. And also, we think it's very important to make this solution accessible and affordable. So how we can achieve this? Actually, we think firstly, we should lower down the cost of this solution. For example, for SNIDE, and also a lot of companies like Roche Siemens, they also manufacturing this kind of solution in China, because China have a lot of talent and a lot abundant of population that we can make the manufacturer cost low down. And also we have a lot of talent and can develop such kind of solution. And then apparently we can lower down the cost by manufacturing this in China. And at the same time, with the innovation, we try to make some new innovation in this kind of technique for example, for SNIDE, we increase the throughput of this kind of solution analyzer. In this kind of case, we can also lower down the cost of the hospital. For example, in the past, they need to buy 1 or 2 analyzer to handle a huge amount of sample. But for the endeavor of manufacturer that we increase for these few decades for the throughput of the analyzer, we can reach, for example, SNIDE, we developed a fastest throughput analyzer for clear solution. And then in the past, maybe the lab, they need 2 or 3 machines to purchasing 2 or 3 machines to handle the sample. Then for now, we only need 1 machine can analyze all the sample in a short time. And at the same time, we try to make this solution more accurate. We together with also other manufacturers, they developed the small molecule sandwich method. So which we analyze like the hormone is accurate than before. Because this is also a huge burden if we make the test result not accurate. Maybe sometimes it will interfere by some medicine.
Vincent. I think accuracy, improved quality is where you're heading now, right? To make it much more better in terms of diagnostics. Okay, so if you were to, starting from you, Vincent, one word, because we are running out of time. If there's one word you have to use in terms of the future of NCDs for Africa, what would be that word?
So you mean how we can...
Just one word. Please, just one word. One word?
One word?
Yes.
Cooperation, I think.
Beautiful. Imani?
It's a shared journey.
Shared journey. That's not one word, that's a sentence. Okay, Balu.
Innovation.
Digital man. Innovation, yes. Monsieur. Integration. Honorable Minister, is it long sentence? Integration. My sister Cleto. One word.
I make it 2. Multi-sectoral approach. You talked about education.
Multi-sectoral. Okay, no problem. Odunsi.
Education, awareness, and screening.
You are following my hand, as they say in Nigeria. Just one word. Okay, so I think
one word, screening.
Screening. Okay, so that's a key word. So you've heard from them. I think because of time, we will not go around in terms of further discussion, but I think we talked about improved diagnostics from Vincent's angle. We talked about access from Emmanuel, and with Balu talked about digital tech as a key to reining NCDs. Mr. Minister talked about the mechanism of bringing all sectors across to make sure that NCD control is possible, and also foundational to financing it, getting all the stakeholders to be part of it, and the research too. Then my sister from South Sudan, Cleto, talked about strategy as imperative, and the fact that you need to look at it across all the whole health systems, building from primary health care, very critical. And Dr. Odunsi here talked about using her Center of Excellence as an example, looking at all the critical things in terms of getting all the buy-ins from the right stakeholders, right? And as well as looking at the foundationals like screening, making sure that that's a baseline for everything in terms of what we get. So ultimately, the data will inform better decision making. Thank you very much. It's a pleasure. Please.
Thank you very much for this panel, and I don't think that